In this video, we will review concepts related to control of blood pressure. So let's look at some terms. Our blood pressure is divided into our systolic blood pressure and our diastolic blood pressure. The systolic blood pressure is the pressure during left ventricular systole. That means that's the blood pressure when your heart is pumping. That is when the blood vessels have their highest pressure, and so that's going to be the higher number that you see on the top of a blood pressure. A diastolic blood pressure is the pressure during left ventricular diastole. That's when the heart is relaxing, and so the blood vessels will have their lowest pressure, and that's the lower number that you see on the bottom of a blood pressure. A normal blood pressure should be less than 120 systolic and less than 80 diastolic. The pulse pressure is the difference between the systolic and diastolic blood pressure. So if somebody's blood pressure is 120/80, their pulse pressure would be 40. Pulse pressure is affected by stroke volume, or the amount of blood that's ejected from the left ventricle with each beat. It's also affected by arterial distensibility, or how compliant or easily stretched that artery is with the increased pressure that occurs with each heartbeat. We also have a mean arterial pressure, and this is the average pressure in the arterial system during ventricular contraction and relaxation. Our cardiac output is the amount of blood pumped by the heart in 1 minute, and it is determined by our stroke volume times our heart rate. Another important term to know is peripheral vascular resistance. This is determined by the radius of the arterioles and by blood viscosity, or how thick the blood is. Something that's very viscous might be something like molasses, or something that's not viscous is water. We maintain our blood pressure at a regular level by adjusting our cardiac output to accommodate changes in our peripheral vascular resistance, and we adjust our peripheral vascular resistance by accommodating changes in cardiac output. We'll look at the relationship between blood pressure, cardiac output, and peripheral vascular resistance, and then we'll look at factors that affect cardiac output. Both systolic and diastolic blood pressure are determined by cardiac output and peripheral vascular resistance. And both of these, cardiac output and peripheral vascular resistance, are positively related to blood pressure. That means if there's an increase in cardiac output, so more blood is coming out the heart each minute, like with exercise, there's going to be an increase in blood pressure. This is because you have more blood volume in your blood vessels, and so that adds more pressure to the arterial walls. If you increase that peripheral vascular resistance, so if you vasoconstrict and increase that pressure within the blood vessels, remember like the hose where you stick your finger over the opening of a hose, that's going to narrow the opening, making that water come faster out of a hose. And so you have more vasoconstriction when you decrease that diameter of the blood vessel. Or if you have increased blood viscosity, if somebody's blood is really thick, like they have too many red blood cells. This adds more resistance to the blood flow, and so more resistance increases that pressure on the arterial walls. The opposite is also true. If your cardiac output decreases, if you have less blood volume, maybe someone who's severely dehydrated or has heart failure, that's going to decrease your blood pressure because there's a lower pressure on those arterial walls. And if you decrease that peripheral vascular resistance, if you vasodilate, or your blood is too thin, you don't have enough red blood cells, that's going to reduce the resistance to flow and decrease the pressure on those arterial walls. So let's look at some mechanisms that we use to regulate our blood pressure. So cardiac output is determined by heart rate times stroke volume. This can be determined by sympathetic nervous system and parasympathetic nervous system activity. This could be determined by aldosterone from the renin-angiotensin-aldosterone system and by antidiuretic hormone ADH, also known as vasopressin. Our peripheral vascular resistance is determined by vasoconstriction, and this is influenced by angiotensin II from the renin-angiotensin-aldosterone system, sympathetic nervous system activity, and the vasopressin feature of antidiuretic hormone. So let's look at some of these individually. So neural mechanisms of blood pressure regulation begin with sensing changes in the blood pressure. We have pressure-sensitive receptors called baroreceptors. High-pressure receptors are located in our carotid arteries and our aortic arteries. These respond to stretching in those blood vessels, which then lead to changes in our heart rate, which affects cardiac output, and our vascular tone, which affects peripheral vascular resistance. We also have low pressure receptors in our large systemic veins, in our pulmonary vessels, and in the walls of the right atria and ventricles. Triggering of these low pressure baroreceptors lead to changes in secretion of antidiuretic hormone, which increases blood volume through its antidiuretic feature and causes vasoconstriction through its vasopressive feature. Our brain has a cardiovascular control center that the baroreceptors talk to. If the parasympathetic nervous system is activated, that will lead to slowing of the heart rate through the vagus nerve. When you slow the heart rate, you decrease cardiac output. Remember, cardiac output is heart rate times stroke volume. So you decrease cardiac output, thereby decreasing blood pressure. If you activate the sympathetic nervous system, this has more effects. One, it increases the heart rate through the SA node. Two, it increases stroke volume by increasing myocardial contractility. That means the sympathetic nervous system makes the heart pump harder. And so the harder the heart pumps, the more blood can come out with each beat. Think about a time you've been scared or really stressed and you can feel your heart beating harder. That's that sympathetic nervous system increasing that contractility. Both of these things, the increased heart rate and the increased myocardial contractility, will increase our cardiac output, thereby increasing our blood pressure. In addition, the sympathetic nervous system innervates the blood vessels, causing vasoconstriction of the small arteries and arterioles. This increases peripheral vascular resistance, leading to an increase in blood pressure. We also have humoral or hormonal mechanisms, including the renin-angiotensin-aldosterone system and antidiuretic hormone. Let's start with the RAS system. Two hormones from the RAS system play a central role in regulation of our blood pressure. One is angiotensin II. Angiotensin II directly causes vasoconstriction of the arterioles, increasing that peripheral vascular resistance, thereby increasing blood pressure. Angiotensin II also stimulates the release of aldosterone. Aldosterone travels to the kidneys, holding on to sodium or reducing sodium secretion. Water always follows sodium, so by saving sodium, aldosterone increases blood volume through sodium and water retention, thereby increasing blood pressure. Our second humoral mechanism is antidiuretic hormone, also known as vasopressin. Remember that antidiuretic hormone comes from the posterior pituitary. ADH is released when there is a decrease in blood volume or blood pressure. And because ADH regulates water only, if the blood is too concentrated, If there's an increase in osmolality, ADH will also be released. The release of ADH has two effects. The first is that it leads to water retention by the kidneys, and that's its ADH function, antidiuretic function. It tells the kidneys to hold on to water and not release it in the urine. That increases our blood volume, increasing blood pressure. ADH also has a vasopressive effect where it directly causes vasoconstriction of our arteries and arterioles, thereby increasing that peripheral vascular resistance, also increasing blood pressure. So much like the RAS system, ADH increases blood pressure through both increasing blood volume and increasing systemic vascular resistance. The major difference is that ADH saves water only, where the RAS system saves sodium and water. And then finally, let's take a quick look at how we regulate our blood pressure long term. When our blood pressure increases, this causes our kidneys to excrete water through the process of diuresis and to excrete sodium through the process of natriuresis, where water follows. Notice that natriuresis starts with NAT, which looks very much like sodium. When we decrease our blood pressure, when our blood pressure is lower long term, we hold on to more sodium and water to increase that blood volume. And that's our review of mechanisms of blood pressure control.